Good morning, thanks for joining me. Today the National Cabinet has met virtually to discuss the evolving situation with the COVID-19 pandemic, and we agreed on several new measures. First, we heard from the Chief Medical Officer, Paul Kelly, who provided an update on the pandemic, including the new variants, B4-5, and their potential impact and the impact that that was having on hospital capacity and the broader health system in Australia. What was very positive was his report about the substantial increase in the number of people receiving their fourth shot, some 400,000 people in just recent days, and also the increased use of antivirals. These two measures are absolutely critical. So I begin by saying to Australians, if you are eligible to get a booster, get it. They're free, they help protect your health and help alleviate the impact of COVID, including the new variants. And with regard to antivirals as well, we have substantial supplies. We need to make sure that they're used as well, and some of the measures that I'm announcing today are aimed at doing just that. The Commonwealth and the states and territories remain absolutely committed to working together collaboratively to support the health response. All of the premiers and chief ministers, as well as the Commonwealth, understand that we need to get the health outcomes right in order to protect people's health, but also to protect our economy. That when you get the health outcomes right, you protect jobs and you protect the economy. And we're all committed to that. The really positive thing as well today is working towards a much more consistent national approach. And that was agreed, and indeed over coming period, up until at least the end of September, the Commonwealth will meet with the states and territories in the National Cabinet approach every 2 to 3 weeks, just to make sure that we're hearing the updated reports from the AHPCC and to respond as need be to make sure that our approaches are consistent so that people can be clear about the messages which are out there. Now, in recognition of the risks that are associated with the more infectious new variants, we've agreed to reinstate the pandemic leave disaster payment to the 30th of September of this year. I said during the election campaign repeatedly that one of my themes was no one left behind. And indeed, I want to make sure that people aren't left behind, that vulnerable people are looked after, and that no one is faced with the unenviable choice of not being able to isolate properly without losing an income and without being put in a situation that is very difficult. So it is appropriate, given the increases that are there, that we reverse the decision which we inherited from the former government to cease this payment. And going forward, the states and territories have agreed that this payment will be covered 50-50, a shared cost with the states and territories. Previously, the states and territories picked up the bill for temporary visa holders. That will also be shared 50-50, and they picked up the bill for business support that was in place and is no longer being provided. So this is a fair way going forward. All of the states and territories, as well as the Commonwealth, understand that emergency payments are just that. They can't continue forever, given the fiscal constraints that are on governments at all levels, but that this is an appropriate measure going forward. In addition to that, the government will also reinstate the crisis payment national health emergency payments until the 30th of September as well. This will ensure that those affected by COVID-19 isolation requirements who receive an income support payment or ab-study living allowance who are in severe financial hardship continue to receive support during the winter period. The Commonwealth has also agreed to create a new temporary telehealth item so GPs can spend longer with their patients to assess their suitability for oral COVID-19 antivirals. The Health Minister, Mark Butler, met with the Royal Australian College of GPs and the AMA yesterday and worked through these proposals. We want to make sure that antivirals can be administered where appropriate, and in order to do that, this temporary telehealth facility is appropriate that it be established. State and territory ministers, premiers and chief ministers also shared updates on what was occurring in their respective state and territories, also noting the increased access to supplies of rapid antigen tests. Of course, the Commonwealth has already picked up the tab, 50% of the costs of all the rapid antigen tests, and states and territories are making sure that they're available, as well as the Commonwealth through various measures that we have. All of the First Ministers also agreed that jurisdictions will utilise existing RAT stocks funded through these arrangements. The jurisdictions in the Commonwealth also agreed to provide that consistent health messaging out there to encourage Australians to follow the recommendations that were provided by Professor Kelly. These include wearing masks indoors where appropriate, where people are mixing and can't have social distancing, then that makes sense for that to be highly encouraged. Also, getting tested, practicing good respiratory hygiene, and where it is where people are contacts, or where it's appropriate for people to work from home. These measures are important. We will get through this. It was also noted by Professor Kelly that the impact of the flu during this season has also placed pressure on the health system. The good news there is that the impact of the flu is very much way past its peak going forward. I'm very pleased with the outcome this morning, and I thank the Premiers and Chief Ministers for agreeing to the proposals that I put forward in discussions I had with them yesterday afternoon and last night, and I thank them for the early meeting this morning in order to give certainty going forward. What this will do is provide security for people, make sure that we're looking after the most vulnerable, and make sure that people aren't getting left behind. And that is something that will be a characteristic of my government. Happy to take questions.
Prime Minister, why did it take so long for you to decide to reinstate the pandemic leave disaster payments? I mean, you could have made this decision before they expired. Were you convinced by the states and territories?
No, we didn't make the decision. The former government did, in consultation with the states and territories. That was that decision was made prior to me being Prime Minister. I think it's a big call to say that I haven't acted quickly. What we've seen with this new wave of B4, B5 is a changed health circumstance, and when the health circumstances change, we've responded. We've responded collectively, together, the Commonwealth, with states and territories, and that's appropriate.
What's changed your mind, though? Because yesterday you were saying something very different on the pandemic payments. Was there something said that's changed your mind on this?
No, I wasn't. If you look at the front page of newspapers yesterday, I was saying that we would respond to advice which was there. I've said consistently that the decision was made by the former government to end these payments. That's not a criticism of them. They made those decisions based upon what the advice was at the time. I received a briefing yesterday from the Chief Medical Officer as well as the Secretary of the Department of Health. Based upon that advice, we've responded, and we also said consistently that we wouldn't leave people behind. We're making sure that people are being looked after with this response.
You have
Prime
previously
Minister, two things. The September 30, is that a hard end date or could it be extended again? And the second thing, on rat tests, why not a continuation of free rat tests for concession card holders, pensioners? Do they not need those as well, given the situation?
No, it's being rolled out. If you want a list of where you can get a free rat test, I'm happy to provide them to you. New South Wales has made an announcement about that. WA are distributing them to anyone who wants them, not just concession card holders. South Australia, they're being distributed. They've been provided through aged care centres. They've been provided anywhere where you can go get a PCR. You can rock up there today and pick up a rat test. There is no shortage of rat tests in Australia, and the Commonwealth has paid for half of every one of them.
You have previously argued, though, that the budget does need to be balanced
And
these
it does.
payments can't go on forever. So just picking up on that question about whether it will definitely end at the end of September, and just why you have felt that you need to backtrack on that issue about the budget.
No, well, there's been no change in position. The budget is an issue where we've inherited $1 trillion of debt. There was $1 trillion of debt yesterday and there's $1 trillion of debt today. We do need to act on this, and all state and territory governments understand that as well. The truth is that we have real fiscal pressures on, and a number of measures were put in place that were temporary measures. They were temporary measures based upon the advice that was received at the time of the former government. We've received advice based upon this surge that is occurring. We want to make sure that people's health is looked after and that vulnerable people are looked after, and that's why I've made this positive decision today, and it's been supported by the states and territories, and I thank them for it.
Have you got a rough guess on how much it will cost by the end of September 30? I know it's hard to say, but any estimates?
We do have estimates. It's expected that the share will be a share of just under $800 million. It's around about $780 million to be shared 50-50 between the Commonwealth and the states and territories. But we'll wait and see in terms of the outcomes. The clear eligibility requirements will be are available. They're consistent with the previous eligibility requirements. They'll be available from Wednesday morning. If people want to apply, they can apply online, or people who can't claim online will be able to claim by calling 180-2266. Don't call until Wednesday, the 20th of July 2022. Systems will be established between now and then. Services Australia indicates that they'll be able to do that at that point in time. Because it's a new financial year, a number of people have sick leave entitlements that haven't expired, that are ready to go as well. In addition to that, a number of businesses have adjusted to the way that they deal with these issues. So it may well be that the cost is less. We hope that we can restrict the spread of this virus, but it's expected from the indications from Professor Kelly that we can expect an increase in the number of cases over coming weeks, but that is likely, the advice is from the AHPCC, that it's likely to peak in August and then will decline. That's why we've picked 30th of September to finish these payments. We'll continue to monitor the circumstances which are there.
Prime Minister, did you discuss or are you considering changing the isolation requirements potentially from 7 to 5 days? Because that's the key issue here, isn't it? That people are legally required to isolate. It's not a choice for whether they can go to work.
They are, but the advice from Professor Kelly is that whilst this surge is occurring, and whilst it is the case that for most people, particularly because people are vaccinated, the symptoms will be relatively mild, that now is not the time to change that advice. But that is something that will continue to be monitored and will come from the health experts, and people will listen to that. Just a couple more.
Prime Minister, you mentioned cases are expected to peak in August. Did the Chief Health Officer have any modelling to show what kind of numbers we should be seeing? Do we have estimates on how high cases will get? Can you put a number on it?
Well, the Chief, it's not appropriate to some of these things done in a way which is, to put a number on it is to allow the health experts to answer that. Is probably the best way to do it. But they expect that there are so many variables. In part, it depends upon what actions people take. There will be less spread if people take more action, if more people wear masks, if more people get vaccinated. It will provide more protection. So I'd encourage, and certainly the Chief Health Officer as well as the officers in respective states and territories will encourage people to follow the health advice, to take precautions. This is a very infectious disease, and the Chief Health Officer likened it to the infection rate of measles rather than the previous variants of COVID. And that is something which is a sobering thought for people. So I would encourage people to follow the advice, to make sure that they engage in social distancing, to make sure that they wear masks indoors if they're in crowded areas, to make sure as well there are still some measures in place, for example, of wearing masks as mandated in specific areas, in aged care, in areas like on public transport here in New South Wales. I'd encourage people to follow that advice.
And Prime Minister, just on that, sorry, can you provide a little bit more detail around these longer telehealth consults for antivirals? Is there an end date on that? Is it just for antivirals, or is it for any telehealth consult over 20 minutes?
Well, it's not just for antivirals, because some of the telehealth consults will be about whether an antiviral or what the health concerns are. It will last until the end of October this year is the proposal. We'll put out all of the detail in full documentation this afternoon, so people will be able to see that. Thanks very much.